Look at this little guy right here. And this picture right here too. And I don't know about that one. And this one for sure. Look at this poor little baby mouth tongue. This thing right here is what we're worried about. Now if you also take a look at this mouth right here, that's called the tongue tie, or ankyloglossia. And if it's real bad like mine, it can do a lot of bad stuff. And I want to cut mine so that my tongue isn't all tied up. But I don't want to have to pay an arm and a leg to a dentist to do it. So I've been researching it. These are the notes I have thus far, and I'm going to walk you through them. Starting with how to cut a tongue tie at home. So this probably goes without saying, but I am not recommending you follow my advice or do anything that I do. There's also a very good chance that I will not actually go through with this, but I want to look into it to see if it's actually an option or not. Because like, what, do dentists have magic hands or something? Do they get some special permission from the gods that they can do surgery and like cut things? No, they just did some research, they got some training, and then they just went for it. So why can I not do that also? Let's try this one, Alabama Tongue Tie Center. Don't get that tongue tie clipped or snipped, get a full release instead. These pictures are way too close to see what's really going on. So it seems like they're basically making the case that a lot of people will get like the tie just snipped with some scissors, like the dentist or whoever is doing the operation will just use some sterile scissors and just cut through the tissue, what's it called? The frenulum. But then after they just snip through it, it will grow back or something, it looks like. So it looks like if they do a clip, they will almost always cut halfway with scissors and leave a thick band of tissue. If it's cut halfway, it will work half the time. Here, more proof that maybe I should just do it myself, because these are physicians performing this procedure, but they're well-meaning physicians who have studied and done the research and whatever you would think, but the clips aren't done properly because they haven't been trained in this specific area. They've been trained on like general health and surgery and not like how to do this specific one. It's really hard to see what's going on in these pictures. This baby was clipped by a pediatrician and her salivary glands got turned into a cluster of grape-like openings. That sounds horrifying. I don't want my salivary glands to be a cluster of grape-like openings. So it sounds like the reason why it doesn't always get clipped correctly is because once you start to clip it, the tongue will start bleeding and then all of the blood is covering the tissue in your mouth and you can't see what's going on. You can't see where you need to keep cutting. Oh, look, they have online courses on how to perform a full release. Let's check it out. Tongue and lip tie resources for professionals. Okay, this looks like they're just selling a course by the book, or they also have an academy course or a live course. They're saying that 25% of the population may experience the effect of tongue or lip ties. Although this is the Alabama Tongue Tie Center, so they might have a little bit of a vested interest in people having tongue ties, in people needing surgery. They also have some patient resources here. Let's click on that button. Help for you, hope for your child. Resources for parents. I guess I should probably define what tongue and lip ties are. So they're this thing right here. That piece of tissue right there, the frenulum, if it is connected to too much of your tongue, then it can inhibit the movement of your tongue. So your tongue can't move correctly and it can't stick out past your gums. And I think one of the main problems is that especially if you are like a newborn infant, you can have trouble latching onto the breast to get milk and nurse. Here's a good picture. This is one of the main problems. But then when you're an adult, you can have trouble like cleaning your teeth because your tongue can't reach all of the different parts of your teeth in your mouth. And it can also cause a lot of like tension in your neck because your tongue is being like held forward in your mouth. So your tongue can't really relax. So it's causing a lot of tension in your back. This is what I've heard. It can cause difficulty with nursing, making it harder to brush the top teeth. It can also lead to a gap in the teeth. It can also lead to dental, speech, sleep, or breathing problems. If you're an adult, it can cause sleep issues, headaches, neck pain, shoulder pain, and speech problems. So that's kind of a brief overview of what it actually is. So this is showing that this one is obvious and this one is not so obvious. That one, I wouldn't have called that one a tongue tie. I mean, maybe a little bit. But see, this person can stick their tongue out quite far. And this person, when they try to stick their tongue out, the frenulum is holding their tongue back so that it turns into this like heart-shaped. This one is quite severe. This like heart-shaped tongue. Okay, so this says that it's usually a one-day procedure. They'll get to the root cause. They don't do the traditional snip or clip. They release it completely in a 15-second procedure using a CO2 laser. Oh, they don't use sedation or anesthesia. There's minimal to no bleeding. Interesting. What's up with this CO2 laser? CO2 laser for tongue ties. Light scalpel. What's going on this page? Oh, here's a video. Let's watch. Whoa, so here's like the little light scalpel pen. And here he is burning. Oh, he's burning away the frenulum on this little child mouth. This looks like a little infant. Wow, whoa, look at that. Look at all that burned tissue in the poor little baby mouth. So this is the lip tie. There's the little baby nose. Wow, that's all burned and cauterized. Ooh, the poor little baby. So they got a little metal spatula tool here to keep the tongue out of the way. Here he goes burning with his little light pen. There's a little laser. So it looks like the laser. How is the laser not cutting like way deeper? So he's doing some cutting, peeling back. It's kind of like he's like peeling back the tissue almost. Wow, that looks like it's going really deep. Is that not going really deep? Yikes. Hey, cameraman, get a better shot. You're slacking on your job, cameraman. Oh my goodness, look at that. That is ooh, yikes. Okay, let's watch another video maybe. This one. Oh, it's another same company video. This woman got hers done when she was 41. Wow. So here's the pre-op, and there's also a lower lip tie and an upper lip tie. So here they are releasing the tie again. Oh, here it is in slow motion. Whoa, what the heck? Apparently it popped when they released it. And now oh wow, yikes. This is a better video. Chopping away that lip tie. Here's the upper lip tie they're doing. Oh my gosh, look at that laser go. This like slicing. Ooh, look at that. It's burning like the flesh away. Oh my gosh. Oh, that's horrifying. Wow. So that was the lip ties, and now they're gonna do the tongue. So there's the tongue. So there's the frenulum that they're cutting into, just like separating it, peeling it back, like a freaking like a cutie, like a mandarin skin. Oh my god. Oh, that looks horrifying. So it doesn't look like they did that much. They didn't go that deep there. Are they not done yet? They must not be done yet. They're still going at it. Going to the side. I wonder if they're gonna do that thick part in the middle. Maybe they gotta do the sides first. That looks like it's gonna be painful. Is it not painful? Got a hand in the way. Ooh, now there's some fluid seepage. Okay, I think I've seen enough of that. Here's the immediately after the post-op. So immediately after they're done, it's not really bleeding. It does look quite red and raw though. This one also. So she's saying that she used to have a lot of neck pain. So one of her physicians brought the attention to the tongue tie, saying that releasing the tongue tie could get rid of some of her neck pain. She said she had a lot of personal things going on in her life that were stressful that would normally be triggering like a huge, she said she had a golf ball sized knot in the back of her neck that normally would get triggered by like stressful things, but after the frenectomy, it's pretty much all been gone. She's explaining how she has like more flexibility and mobility in her whole like back and shoulder region. Crazy stuff. Wow, that was wild. Okay, let's do a little bit of digging about like what the frenulum is actually for. Like, why is that thing in your mouth? I feel like if we learn a little bit about like the anatomy of the mouth and what the parts are for, that might help me in my journey to cut it myself at home. Although now that I've watched this video, I'm a little bit like, yikes, but gotta do it for science. What is the tongue frenulum for? kenhub.com. The lingual frenulum. So the frenulum stabilizes the tongue and helps to provide support during activities like speaking, eating, or swallowing. It's a support structure. Here's a little diagram. So here we got this green part right here is the frenulum. And it looks like, that one looks like it's kind of advanced. How far up does it need to go to actually be a tongue tie? Where's the cutoff? When does it start impeding the movement in like the function of the tongue, I guess, is my question. Let's look at this. Tad Morgan, DDS. Anatomy and function of the tongue tie. Oh, this is about the tongue tie. Might be too specific. So it looks like more of the same about how the frenulum keeps the tongue firmly attached to the mouth, to the floor of the mouth, prevents the tongue from protruding too far, and keeps it in the correct position. Kidshealth.org. What causes a tongue tie? Nobody knows. Doctors don't know what causes it. How is it diagnosed? Oh, here's a good question actually. So if it is limiting the movement of the tongue, so if the kid is old enough to talk, the doctors will listen to them speak. Sometimes you might need to see a specialist like a pediatric dentist, oral surgeon, blah, blah, blah. I mean, like, why would you need a specialist to diagnose it? Like, should it not just be that if it's too high up on the tongue, you would need to get it cut, and if it's not so high, you don't need to worry about it? I'm wondering why so many people have tongue ties. Like that other article was saying like 1 in 4 people have tongue ties. Why is that? enttoday.org. The dramatic rise in tongue tie and lip tie treatment. Oh, it looks like these people are making the case that basically tongue ties have been around for a long time, but the like social media is popularizing people being like, oh, your child is having trouble latching, your child is struggling with this or that, it's just because of the tongue tie. Just get that sucker cut. So they feel like, it seems like this might actually be kind of a controversial issue where some people are recommending everybody get it cut, and other people are against that. Here's a picture of it being performed in 1697. Considerable controversy surrounds this condition. All of these people, oral surgeons, pediatricians, speech therapists, often have differing opinions regarding the definition, clinical significance, need for surgical intervention, and timing of treatment for this condition. With the recent inclusion of posterior tongue ties, there has been an overdiagnosis of ties in some areas, leading to babies having the procedures that are not really necessary. Ooh, yikes. Okay, this image is reminding me of why I'm doing this research in the first place. If I wanted to do this myself, got some hemostatic dressing. What is that? I got some little clamps here, maybe some scissors, some neo something. Oh, and this is a little tongue spatula with a little slot for the frenulum to go in. Okay, under treatment options, it says that a lot of people use sterile scissors and silver nitrate sticks to stop the bleeding. What are silver nitrate sticks? Silver nitrate sticks. Let's see. Well, if I'm gonna need them for my own procedure, I'll probably look at the shopping one. Let's see. So it looks like a matchstick. Caustic wooden sticks. What are these used for? Little sticks. $25 at Walmart. Ooh, I could get them at Walmart. Or Medex Supply. More expensive. Oh, here's one for $8 at Walmart. What do they actually do though? Wound source. What are they? So it looks like it's some kind of cauterizing agent that's when it comes into contact with moisture. When it comes into contact with moisture, it activates, and silver nitrate sticks deliver free silver ions to the tissue that form an eschar. What the heck is that? As they bind to the tissue and obstruct vessels. So they basically just help to stop the bleeding. That sounds like. Okay, interesting. Okay, so if they're struggling to agree on like what actually qualifies as a tongue tie, how can I look and find out, like, is there a definition? Is there like a criteria? Examples of ties that need a frenectomy and ties that don't. Not seeing a ton of super helpful comparisons. Not a lot of comparisons, just a lot of like lips and tongues. And I'm sorry if I'm showing you too many mouths. Hopefully you're not squeamish about this kind of thing. Ooh, that one looks quite severe. Is this before and after? Let's try instead frenulum that needs a frenectomy example. Emporia Dental Center. What is it? Who needs one? It's not really answering my question. Looking through this, I'm not really sure that I'm going to get an answer for this, or that it's going to be that simple. Maybe I should just look into like how dangerous is it actually? Am I actually gonna, if I get the procedure done at a dentist, is it going to be more or less dangerous than if I do it myself? Let's see. How many botched frenectomies are done each year? No, no, I'm not going to search that. That's going to freak me the F out. This is already kind of like stressing me out a little bit thinking about getting it done. Let's try instead. How many successful frenectomies are done each year? Maybe if I get a baseline for how many successful ones are done, then I could compare it to how many ones are botched. Let's look at the NIH.gov. Ankyloglossia and lingual frenectomies. National trends in diagnosis and management. Where's the abstract? This is more just about like how they are diagnosing ankyloglossia more than they used to, and how they're performing more frenotomies, and how they're more often in male children, which is not really an answer to my question. I don't think I'm going to get an answer to this question, it's just fine. I don't need to know this information. I'm wondering like what actually qualifies as a tongue tie. Like are there any criteria for the people who think that tongue ties are misdiagnosed or overdiagnosed? Like what would they consider to be an actual tongue tie? Criteria for what qualifies as a tongue tie. Mayo Clinic, tongue tie ankyloglossia. Here's the image that they are presenting, which is just more of the same. You know what? I'm getting too distracted by just random things that I don't really feel like matter that much. I'm trying to perform this cut on myself, so I need to know practical things, right? Let's go back to the silver nitrate sticks. Let's look into those a little bit. For instance, are silver nitrate sticks safe to use in your mouth? According to the AR, no, they are not. Drugs.com. Drugs. So usually silver nitrate sticks are used to get rid of warts, skin ulcers, mouth sores, and they could be given for other reasons. Okay, according to this, it definitely doesn't say don't use them in your mouth. It just says they can be harmful if swallowed. If you swallow it, call poison control right away, which is not reassuring. And if you have broken skin or open wounds, be cautious. They're used for sores in the mouth, so can they be used for frenectomies? Are silver nitrate sticks used for frenectomies? Wound source. What are silver nitrate sticks? This is just a pet peeve of mine, but I hate it when websites have their menu bar so freaking big. Covers like half the screen. Silver nitrate is corrosive to both clothing and skin, and protective measures should be taken. This is a little bit horrifying that they use this in people's mouths. if you're going to use silver nitrate sticks, you should you should put on gloves, and that will protect you from burns. How are these? Yikes. And they use these in your mouth. Also, side note, my son was just born, and he had like this little, he's like just a couple weeks old, and he had this weird little thing with his belly button that was like oozing, and they were going to use silver nitrate on it to like stop it from oozing. And I'm like, he's 2 weeks old. Stuff is freaking wild. I don't want to use this on him. More search results. Whitley Pediatric Frenectomy Care. So the area so it looks like they definitely are using silver nitrate to help with frenectomy aftercare. This says that this area might be stained temporarily from the medicine they use, which is silver nitrate. So if these people are using it and saying it's like common, then I'm sure other people are also using it to stop bleeding. Okay, I feel like the most practical thing for me to do at this point would be to like watch some videos of an actual frenectomy. You know what I mean? Let's go to YouTube. Enough theorizing, enough research. Let's look at things. Frenectomy operation. Because we already watched the one with the light laser, but if I'm doing this, I'm not using a light laser. I'm going to be using like scissors or like a scalpel or something. So I'm going to need to know how people are doing it with a knife, right? So they are applying a anesthetic gel and something else. I don't know what that is. Here they're doing lidocaine right there, and then numbing it all up, and then they're going to use some little clampy clamps to clamp down on. This is a lip tie, so they've got that lip held up out of the way. So they're clamping in 2 different spots, and then they're just going to use the knife, just to follow, yikes, follow the curved line of the clamps with the scalpel. Oh, it's nice he's got the instruments they're using on screen. It's convenient. And they're suctioning the blood out of the way, it looks like. So they're just holding on tight to the skin with the clamps, and then cutting, and then trying not to cut anywhere that's not being held on by a clamp, which I feel like seems legit. Oh, yikes. So that's after they cut it out. Oh my gosh, but he's cutting in. What the heck is he doing? He's cutting into the gums to do something. I don't know. Why the heck would you cut into the gums like that? Ugh. And then they're suturing it shut. Yikes. Poor little kid. The kid's like 10 years old. Why would you do that to the poor kid? I mean, I know why, but still. The Breath Institute. So here we've got a guy. This is how they do it for the posterior tongue tie. I'm not sure what that means, posterior. So it looks like they're numbing him up a little bit. Get him some lidocaine. Nice close up of your lips and your stubble there, sir. Okay, so they've got a little spatula to keep things safe, keep things out of the way. They're doing the same clamping method on clamp it. It looks like they're leaving like a deep indent into the skin with those clamps. Oh, so the top one is not a clamp. The top one is like a pair of tweezers type thing. Well, look at those deep indents that the clamps left. Those are some pretty gnarly dents. Is that normal? Oh, here he comes with the scissors, clipping through the clamped spots where the indents were. Now he's clipping into the middle a little bit. It looks, there's like very little blood. Where's all the blood? Where's the blood at though? Maybe a little saliva in that guy's mouth. He had to close his mouth for a second. Okay, so they're still going. Wait, what? Oh, they're clipping. Okay, now they're clipping through the top. So he's got 2 different incisions there, like on the top and on the bottom. And now he's clipping away the excess in the middle. Clipping away the excess. Well, okay, he's going like really deep. I feel like, why was that not enough to just clip away? Why was that not enough to just clip away the excess right here on the sides? Is that not releasing enough? I also feel like this guy doesn't have a very strong tie. Like, this is starting like way back here. Yikes. Okay, now they're going like way deeper. So it looks like he's just clamping it to get it to release. Like as he's clamping it, the tissue is getting like much less strong, and it's just releasing on its own. Well, now he's using the scissors, but before he was using the clamps. More lidocaine. See, look, he's just pulling like he's clamping it so much, and then it's like damaging the structure of the whatever so much that it's just like pulling apart on its own. I feel like he's going so deep there. Wow, look at how deep that is. Yikes. Is he not cutting into like the tissue under the tongue now? Is this what they were doing with the laser? This seems more excessive than what they were doing with the laser. Or maybe it was just a lot quicker so you didn't see it. Also more involved. Let me watch a different one. Actually, before I watch a different one, let me look up where not to cut during a frenectomy. Because I feel like it would be important to know. Because I know there's like other glands and stuff in there that are probably don't want to damage, but I'm not sure where they are. Reeves Dental. Let's see, complications associated. There can be excessive bleeding, infection, scarring, damage. Oh, damage to tongue, nerves, or salivary glands. Yes, okay, so let's find out where these things are, starting with the salivary glands. Where are the salivary glands in the mouth? Cleveland Clinic. This is showing that they're like under here somewhere, but I kind of was hoping to get a picture that's more full frontal. like this one maybe. Salivary glands overview. So the green is the, wait, so here is, I'm confused. I'm pretty sure the green is what they're trying to highlight, but I'm not seeing what exactly. Okay, it looks like here, sublingual glands, something. Is it that little dot right there? There's a little tiny dot right there at the base of the frenulum. That looks like it's probably the opening for the salivary glands. Let's go back and see if there's a real mouth that shows it. Britannica.com, salivary glands. Okay, so here we've got, this one's a little more realistic looking. Yeah, okay, so the duct of the semijugular gland is this little opening right here with a little vein going this way. And this is also another one, sublingual papilla. I'm not sure what that is. Are these both salivary glands? Not sure. Okay, so according to this diagram, it looks like there aren't any arrows pointing to any other things in the mouth around the frenulum. So you've got the frenulum right here, and then these two salivary glands right here that are close to the frenulum, and then all of this other stuff is not close, which means I shouldn't have to worry about it, in theory, I'm hoping. So you really only need to worry about cutting this and the tongue and those glands. Okay, so I think that answers my question pretty well. Let's look up things to look out for after the frenectomy. Oral and maxillofacial associates after frenectomy. Some pain is normal. Should just be able to use a little ibuprofen or some acetaminophen, whatever. A little blood might ooze for the first day or so. In the event of excessive bleeding, a wet, plain black tea bag can be put over the site. Huh, wait, what? You can put a tea bag on it to stop the bleeding? Side quest acquired. Can black tea be used to help stop bleeding? Oral and facial surgeons. Can tea stop bleeding after wisdom teeth extraction? So the tea has to be caffeinated, black tea or green tea. Why though? It's because of the tannins or tannic acid found in caffeinated tea have properties to promote blood clotting and coagulation of blood vessels. Interesting. It also helps to maybe kill bacteria and prevent infections. That's really cool. Let me look into this a bit more. Tannins in tea promote blood clotting? NIH.gov. Green tea stuff for anti-hemorrhagic and antibacterial effects. Ooh. So they're basically just developing a topical thing to help to prevent bleeding. It looks like the formulations they created were able to stop hemorrhage approximately at an equal time compared with tranexamic acid. Interesting. That's pretty cool. So based on the results, the green tea extract has a great potential to stop bleeding. That doesn't really answer why though. Back to results. Nature. The old teabag trick. So it looks like somebody called after some kind of tooth extraction maybe, and was like bleeding a lot, and they'd already used up all the gauze that they had been given from the dentist, and instead of going to the emergency department, they used a tea bag because that was the person on the phone they were talking to was like, just use a tea bag and see if that works. And so they used it, and that controlled the bleeding, and I didn't have to go to the emergency department. Wild. There's very little actual information about like what's going on with the tannins, so that's fine. You know, this makes me wonder though, could I use tea bags instead of silver nitrate sticks? Because that would be nice to not have to put the silver nitrate in my mouth and worry about swallowing it. Can I use tea bags in place of silver nitrate? Brigham and Women's Hospital. Instructions after an oral biopsy. So they give the instructions: dampen the gauze and apply pressure for 15 or 20 minutes. You can also use a tea bag. This seems like it's like a fairly common procedure to stop bleeding. I'm not getting a lot that's very specific. Let me try a different approach. Silver nitrate sticks versus tea bags. Still not really what I was hoping to get. Let's think about getting specifics. How quickly do silver nitrate sticks actually control bleeding? Maybe we can get some info on how fast the bleeding stops so we can compare one to the other. Good RX. Silver nitrate works by burning off the skin or tissue, which causes the skin tissue to die and fall off. That sounds pleasant. Side effects. Staining of the skin. Pros and cons of silver nitrate. They're easy to carry around. They can be used on dry skin and mucous membranes. They can be applied at home. Hey, that's for minor conditions. That's semi-encouraging. The cons, though, is they can cause chemical burns if you're not careful and do some other stuff. Okay, I'm not seeing how quickly they can control the bleeding, though. Let's keep looking. The NIH has one. Topical silver nitrate for management of hemostasis. Review of effectiveness. It seems like this is saying that it can be either like a couple minutes or a couple hours. This is not really clear though, kind of unclear. So So as long as the tea bags are controlling the bleeding within like a half an hour or an hour, they should be at least comparable, right? And I feel like maybe a little bit safer. Let's look at tea bags now. How quickly do tea bags control bleeding? COFSC, post-op instructions. All right, so bleeding, expected. So once again, they're recommending putting a tea bag in, and it says bite down on the tea bag for up to 30 minutes. Should help stop the bleeding. It doesn't say anything else. So 30 minutes as a baseline, maybe. Let's keep looking. Adelaide Dental Duct, California. How to use a tea bag to stop bleeding. So this says bite down gently on the tea bag to keep it in place for about 20 to 30 minutes. After that, check. If it's still bleeding, repeat the process with a fresh tea bag. Okay, so again, 20 to 30 minutes. Seems pretty reasonable. I feel like 30 minutes doesn't seem like that bad to stop the bleeding. I mean, it probably won't stop the bleeding immediately, but it doesn't seem like the silver nitrate stops it immediately either. Okay, I think that answers my question about the bleeding bits. The other question I had was about massaging, and like I've heard that you need to like kind of stretch it out to keep it from healing, like healing back together. Do I need to do any stretching exercises after a frenectomy? See, Colorado tongue tie. They've got some videos posted. Let's watch a few videos. So he's giving instructions about how to massage. Well, let's see, he's like holding up the tongue and putting his finger right at the base. It sounds like you really need to put your fingers right at the base to get the tissue at the bottom to come up. Otherwise, it's not going to come up by itself. It's just going to get pulled. So you're looking for this triangle or the diamond shape down here at the bottom is really what you're looking for to get that to separate. Here's a little bit of the actual technique. Put your fingers inside the teeth right here and put your other finger right here on the tongue and separate them. Pull them apart gently. How about this one? Another method. So in this one, you need to put your fingers together, put them together and pull up at the same time until you see that diamond triangle shape there at the bottom. That's what you want to see at the bottom as they're pulling up on it. Here's some little baby ones. I don't want to see baby ones. Let's look at the baby. Poor little baby. Oh, yikes. So he's pulling up and counting to 5 as he's pulling up. 1, 2, 3, 4, 5, 2. Oh, poor little baby's crying. Sad baby. And then he's getting in there. Oh, he's pulling up on the tongue there. It's kind of hard to see, but he's got that. There's the little diamond shape. Let's look at the little boy one. Poor sad little boy. So he's pulling up on the lip tie. You can see the like triangle diamond shape there in the middle where he was cut. And then in the tongue, he's getting his fingers in there. He's doing like the 2-finger method that the guy was showing. And it's hard to see, but there's that diamond shape, the white thing right there. He's lifting up to keep the flesh from connecting again down there at the bottom. Sounds like, so they said the fold of the diamond across the middle is the first place that it will reattach. So this is kind of like the goal is to keep that fold across the middle of the diamond from being able to reattach itself. Okay, that makes sense. But this is kind of reminding me that I probably should have thought to do, because I've heard that you can like massage your tongue to release a tongue tie before you do the surgery. I know I think it's usually recommended with children, but I'm wondering if you can do it as an adult, or just even like what the massages are in the first place. How to massage a tongue tie to release it. Oh, okay, here, wait, this is a better search. Let me search this. How to naturally release a tongue tie. Tongue tie Phoenix. Exercises for non-surgical frenectomy in babies. Okay, this isn't babies, but still. Tongue massage. Can massage their tongue. Cheek massage. Press down exercise. Palate massage. Tongue lifts. If you're doing this one, be careful post-surgery. Is this post? I thought this was all meant to be non-surgical. These are all very written. Let's see if we can find a video. Back to YouTube. How to loosen a tongue tie naturally. Doesn't look like it's that common of a search. Seems like all of these massaging techniques are post-surgery. But let's look at this one. Oh, poor little baby's crying. So that's a pretty bad tongue tie right there. So it looks like I'm not really sure what they're doing. They're just having the baby suck, and I'm not sure what they're doing there. It's a little bit confusing. What about this one? Looks like as a baby, you can have them put your finger onto their gums and have them bite down on your finger, and that will kind of get their tongue to push on your finger naturally, and it'll work it around to kind of stretch out that tongue tie. I also low-key just got distracted by this video that YouTube suggested me, but these are like a really good video of these salivary ducts or whatever they're called. So like you can see, she's got the freaking needle thing into the duct right there. Like what the heck? She's gonna put it in here. So you can kind of see those 2 dots right there. There's a dot. What the? You're gonna put it inside the? Oh my God! She's putting it in the duct. Ah. Anyways, so those are where not to cut right there. This one and this one. There's one on either side, and you can see it kind of those little dots there. Anyways, okay. So I guess I'm gonna have to use scissors probably. I don't know if the massaging thing is going to work because I'm not a baby anymore, but like I kind of wish I had access to a laser. Like, how dangerous are these laser things? Could I get one? Could I get one? How difficult would it be to acquire a laser? How do they work even? Frenectomy light laser. They're not going to sell me one. Let's include shopping. Shopping. Jesus Christ, $3,000? Let's see, this is what the light scalpel LS 1005. Maybe I can DIY it. DIY light scalpel. The AI thinks it's not a DIY project I should be doing. How difficult would it be to make a laser that can do like a little cutting? Question mark? Let's look at this light scalpel one. LS 1005. CO2 laser. The most efficient and affordable. Oh, this is like the page if you want to like order it, I suppose. Or you could take I could take a test drive. Can I just test drive it one time and then send it back? It's got a maximum average power density of 20,000 watts. Laser wavelength is 10.6 micrometers. Laser peak density on target is 100,000 watts. I don't know what any of this means. Hold on, let's look at one more. This makes me think, like, what if I could repurpose like a different kind of laser that is used for other things and then just use it in my mouth? Engraving laser. It looks like these are all pretty much going to be inside of a machine where you can't really control them or hold them. I was hoping for one I could hold in my hand. Let's try laser hobby pen. These are like laser pointers. I feel like I had seen something in the past of like a laser that could burn wood. Like you could use it to like draw in designs or patterns into wood. Is that not a thing? Is there a laser I can use to etch wood? It looks like they're all just machine ones, or like ones that are put on tripods and you can't really move them. Also, they're also a little bit expensive. $259 for this one. $600 for that one. Yikes. Maybe repurposing one of these wouldn't be that great of a deal. Okay, this seems like it might be a bust. Let me change tack. I'm still wondering, is it even worth it to get a frenectomy as an adult? Ooh, a Reddit thread. Yeah, let's look through this Reddit thread. The original post was deleted, but this person seems very encouraged by the person's post. Had a lot of neck and shoulder pain. They're excited. This person got a grade 3 tongue tie released a few months ago. What the heck is a grade 3? How have I not heard about different grades of tongue ties in the research that I've done thus far? This person felt like it's really great, and also they're a ½ inch taller than before because they were stretching out their shoulder and they were also like hunched over before. This person feels like their face looks different. Profile shows the jaw and mid face came forward, the front of the face lifted. So this person had to do 6 to 8 weeks of exercises before and after the surgery. This person said their rib cage and diaphragm are in better positions afterwards. It sounds like this person is thinking like if you get the frenectomy but don't do any myofunctional exercises, then you'll just revert back, which is interesting. Are these myofunctional exercises different than the stretches? I might need to look this up. Also, what the heck is a stage 3 tie? Myofunctional therapy after frenectomy. Enclave dental. Before and after tongue tie. This is a horrible font. So it sounds like myofunctional therapy is basically just like face and oral structure therapy. Exercises to train the oral facial muscles to work harmoniously together. Promotes a proper bite, easy breathing, correct facial posture, and that kind of thing. Back to the YouTube. Myofunctional therapy exercises. Let's try this one. So she's lifting her tongue to the roof of her mouth and then clicking it down. Like maintaining suction, holding it for 2 seconds, and then releasing it so that it makes a clicking noise. Repeating this 20 times, 3 times a day. I mean, her tongue looks pretty tight to me. Wow, this little girl like is not tight at all. That's kind of crazy, the difference between this and that. Let's try for a tongue tie. This one maybe? Waggle spot, 10 times a day, 10 times, 3 times a day. Waggling her tongue, so stick it over to the corner as far as you can go. Touch the tip of your tongue to your cheek, to your ear. Do this 10 times, 3 times a day. Waggle flap. Point your tongue down and then stick it up towards your nose. It's called the waggle flap. This is the pop and click one where you suction it to the roof of your mouth and then click it down. Tongue pops. Lizard. You stick your tongue forward as far as possible to fill the stretch. Make sure to get it over your teeth, is what it sounded like she said. Do it in front of the mirror for optimal extension. The spot needs to be done 30 minutes. Sit down in front of a TV show or something. Shouldn't be speaking with your tongue on the spot, lips closed, teeth slightly apart, and breathing through your nose. So it sounds like that one is just keep your tongue in that spot for 30 minutes. Okay. I still want to know what the stage 3 tongue tie is. Oh, I guess it's grade 3. Grade 3 tongue tie. Let's look at this picture. Mountain View Pediatric. Okay, so here it says case study grade 3 tongue tie released. But that doesn't give me any indication about like what the grades are. Like how are they measured? What is this nonsense? Let's go back for a second. This one, Cedars-Sinai, ankyloglossia in children. Okay, so class 1 is mild, class 2 is moderate, severe is class 3, and class 4, the tongue can hardly move at all. Okay, but like where is the like pictures? Where's the more information about like how to diagnose which one is which? How different are they? And they're supporting their non-information by saying that each child is different. Every tongue tie is different, and that's why we can't give you more information about which one is which. Oh god, these people are also saying a small number of babies are born each year, which is like very contradictory to what we learned earlier about how like 1 in 4 people are born with a tongue tie, or whatever it was. So at this point, do I feel like I'm going to cut my own tongue tie? I don't know. Maybe. I don't really want to have to pay an arm and a leg to get it done, but also the things that I've learned make me hesitant. I don't know. I feel like if I just cut just like the little bit of skin right there in the front, just release the tip where that part, the guy in that video did it, where it didn't even really bleed, that would probably be helpful at the very least, and then I could just do the exercises to keep it from coming back together, right? Right? I don't know. Maybe. I think that's going to do it for this video. Thanks for hanging out, and I'll catch you in the next one. Peace.